I wanted to point out why Medicare for all, which I do support, I like this concept of Medicare for all, which would give everybody coverage uh, from Medicare and Medicaid to get medicine that they need to sustain their lives, which I think is pretty much reasonable considering the amount of money we blow on Israel, and, which is an enemy country that attacked the USS Liberty. But also, what is reasonable is it's reasonable to assume that in the United States, people should be able to get reasonable medicine to sustain their life at a reasonable price. The problem is it doesn't go far enough. As many people following this channel might understand, I've had a lot of situations with the medical establishment, both the mental health side and the medical side. The problem is what needs to happen is the government needs to take over direct-to-consumer care. The problem is there is not enough oversight of individual doctors and individual practices. What has happened in the United States is through affirmative action and things like this, medical schools have passed people through colleges from India and Africa and other countries that are not fit to practice medicine in the United States. They are not fit to understand English. They can't communicate with their patients. They don't understand what the patient is saying, and the patient doesn't understand what they're saying. Many years ago, now I am not a drug user. I just am not. I haven't used drugs since I was very, very young, like in my early 20s. Many years ago, I went to the emergency room, and again, with these chest pains that have been recurrent and have been brushed off as a panic attack, or cocaine use. That's the other one. Now, what's funny is I have always come back with a clean drug test because in order to test positive for drugs, you actually have to ingest them, and I have not. However, I had two doctors from Liberia, Nigeria, Ethiopia, somewhere over there, and they're telling me, you have taken a cocaine. That is why you have the chest pain, you taken cocaine. Now, mind you, I was very dehydrated at the time, and they did eventually run fluids after 5 hours of accusing me of taking cocaine. Okay? Now, prior to the most recent situation that happened where I'm trying to get this taken care of, back in December I collapsed in a train station, which was brushed off. Again, the police thought, because it was in Philadelphia, which is a pretty crappy city, the police at the train station thought I was on drugs. Immediately call the ambulance, whatever. But what's funny is, what I tried to explain to the cops, I'm not feeling well. I need medical attention. They tell me, drink some coffee, try and get on a train. I collapse after I try to, I'm like, whatever, screw you. And then I fall over. My legs cramp up. I can't stand up. I'm delirious. So they call the ambulance. Ambulance comes and gets me. They take me to what was called Hahnemann Hospital. It's a local hospital in the area. They determine I have low blood sodium, which made sense because I was visiting my ex-girlfriend who had just had a pulmonary embolism, and I hadn't really eaten or drank much in 3 days or so. I was, sitting in the room because she was between life and death. So the low blood sodium made sense. Unfortunately, again, this caused a recurrence of these symptoms that I have here and there maybe every 6 months, but they've recently gotten quite bad. So what happens is, because there is no control over what individual doctors and individual practices do, this is where you see this stuff like Kermit Gosnell, okay, in Philadelphia, the serial killer that was murdering infants and women as an abortion clinic, supposedly. He was supposedly a obgyn, but he was a serial killer that would keep trophies. Okay, this is because there is not enough direct-to-consumer government care where there is control over the doctors, direct control over these doctors. Some of these people that don't live in the United States, do not know how iffy the medicine is practiced here. When I worked at a public community mental health clinic, which is not publicly controlled, mind you, it's a private contractor, okay, that is a quote non-profit, that is not a non-profit, but the nurse there, she was from the Ukraine and Israel, Ukraine, Israel to here, and she explained to me there would be no way these psychiatrists, the way they behave, there'd be no way this would happen in the Ukraine or Israel, because the Ukraine and Israel actually gives a crap about the quality of the medicine that's being put forth to the patient. The craziness, the absolute contradictory medicines that counteract each other, medicines that interact with each other, it would not take place in another country. So people that are not literally from the United States do not understand how wacky this private medicine issue is, because we have, what it is like Alexandria Cortez said, the problem is we are trying to do a half socialist, half capitalist system of medicine. We need a 100% socialist system. But in that, you have to include the doctors. You have to have doctors being held to a real standard, where you can't have these frickin' people coming out of like frickin' nowhere in Africa going, I'm a doctor now, okay, that don't know what the hell they're doing and don't know how to speak English. There has to be a high standard held by the federal government. It has to be by the federal government. I'm not saying that everything has to be directed through the federal government. The state and local governments could, direct it under the umbrella of the federal government, keeping a tight restriction on what the qualifications are. But the quality of health care, and it's not just the foreign doctors. The doctor that I see is a complete jackass too. But the other doctors I've seen that are foreign are also complete jackasses. It's because there is no universal standard that's being held. They're allowing the AMA and other organizations to police themselves, and they're doing a crappy job. And with psychiatry, anybody that goes to cchr.org or cchrint.org can see how well the Psychiatric and Psychological Society police themselves, which is terrible. There's so much sexual assault, just bad medicine being practiced on the behavioral health side. But the behavioral health side is only the tip of the iceberg, which trickles into the